Hi. Hello, hi. My name is Carlo Juste, licensed acupuncturist, holistic healthcare provider. Just wanted to speak briefly on the subject of acupuncture and any type of shoulder pain or injury, and what are some of the approaches that I take in order to treat patients who come into the clinic exhibiting those symptoms. Or maybe they've been signed here through some kind of they're receiving some kind of treatment either through the VA or it's workers comp or something of that nature. And so, speaking with the shoulder, I think where do we want to start off at? You want to examine what's going on. A lot of times, the trapezius, as well as the muscles that make up the shoulder, the subscapularis, the supraspinatus, and the teres minor, and the teres minor, and the infraspinatus. You want to look at the bicep muscles. We take a look at all the muscles that are above and below the shoulder, and we look at their origins and their insertions. If you've studied anatomy, or if you're an anatomist, or if you understand physiology, that is one area that we have to learn. I never knew anything about origins and insertions of muscles, and uh, in school it's a little bit more. We study that a little bit more as you're in practice. Maybe it's not something that is as prominent in your memory, right? But we definitely understand the importance of knowing where muscles start and where they end and how they pull. Also, through this area, there's a lot of meridians that cross, transverse, uh, not transverse, more a run superior and lateral along the arms, large intestine meridian, just to name a few, large intestine meridian, Sanjiao meridian, um, pericardium, inside and outside the shoulder, right, heart meridian, right. So from a traditional Chinese medicine perspective, there are energy points. There's a path towards the shoulder, and I've done points on the leg to help with conditions such as what we call adhesive capsulitis. That is a frozen shoulder where the patient cannot move their arm and there's no range of motion. Maybe even the range of motion is limited here, but for whatever reason, they cannot move their arm, their shoulder. We call it we do range of motion, which is we check the abduction and adduction. One starts with a B, such as bunny, and the other one D as in dog. Right. So this allows us to check the range of motion of the shoulder, see if you're able to lift the arm and whatnot. You also check the flexion and the extension of the shoulder in order to get a better idea of the range of motion. Maybe I can do that with this arm, as you can see too. So, and I think one thing is I don't want to take for granted, right? And none of us should take for granted our abilities to raise the arm like that. And that's the reason why many people seek acupuncture treatment is because they don't have that ability, or it's painful for them, or whatever the case may be. So, more than happy to guide them in the right direction and be a part of the healing process. And as I had mentioned before, looking at the muscles, seeing if there's any hypertonicity, seeing if there's any pinching of certain nerves, especially in regions around the acromion and the clavicle and all that fun and all those fun muscles around in the area. Um, Interesting, right? Muscles, I say. So, looking at if someone has any issues, if it's just pain, if there's numbness and tingling, if there's any weakness, how can you tell if it's a muscle issue, if it's an issue with the GH capsule, right? Which where the shoulder connects to, it's actually where the humerus connects to the scapula, and usually imaging will help with that, right? And you can't just see right through there. Certain tests you can perform, apprehension tests and Aplys and certain orthopedic examinations that can help, at least help us in determining what's going on, maybe try to pinpoint the problem, and put that all together. It's very, very useful. So, looking at what we can do in the clinic and what imaging can be used for. Once again, as an acupuncturist, people might think that we're only limited to traditional tools or just our theory and physiology and treatment and the physiology of our theory, which is true. We utilize that, but we also love utilizing new age, more contemporary techniques and technology, imaging, right? MRIs and X-rays and lab results, and see what's going on chemically. And then we can put it all together, combine what you have going on, and look at it from a traditional Chinese medicine perspective, or whatever perspective maybe the practitioner has been trained in, and looking at your biomedical condition and results and tests, and we can try to see if there's something we can do and formulate a treatment. So with that, I will try to get more into the physiology and the inner workings of the acupuncture. Once again, maybe when treating the shoulder, maybe we go directly into the area. It's not uncommon for an acupuncturist to put needles directly into the shoulder or away from the shoulder, more either contralateral body parts, which are body parts on the other side. So for instance, if I have pain on my left shoulder, I would put the needles on the right arm or anywhere on the right leg. And or we can do ipsilateral, which is the same side points. So if I have pain on this shoulder and I do points on my left leg, or do points on the patient on their left arm, and it all determines on what is going on. So that's why on these videos sometimes, I don't want to say sometimes, all the time, I mention that you have to see a practitioner. Sometimes I am vague, and that's for a reason, because I'm trying to give you a general idea. When you go into the clinic, you'll be able to speak to a practitioner and dive more deep into the understanding and the inner workings, and explain exactly what is for what's going to work best in your situation. Which I feel that we always say we have this system of individualized medicine, and I think being an acupuncturist and treating patients and working with patients one-on-one, you really do see that there's a standard of care, there's a system of care that is needed in order to address individualized concerns. I see. I see. So I wish I could make this recording a little bit louder. I will work on that. Next time I'll get a microphone. But sometimes you have the energy and you want to go do things. So I hope this gives you a better understanding in terms of how a practitioner may approach treating some type of shoulder injury or pain. And it also gives you some better background in terms of the conditions that maybe an acupuncturist can treat. And if you have any more questions, please feel free to leave a comment, or you can always send me an email, mailbox at csjacupuncture.com, or you can visit my website, or you can contact the clinic. I'm more than happy to speak to patients and individuals and offer my consult, my 2 cents. So many blessings during this time. Please stay safe. As you can see, I have my mask. There's no one in the office here, so it's okay for now. Right? I'm going to be doing a cleaning in this, and I confine myself to a space. I'm going to be cleaning this room, be spraying everything down. Trust me, I'm taking every precaution. So, but I wanted to speak so you can see me and hear my voice and all that other fun stuff. So it's a little bit clearer. Sometimes I do record videos with the mask. So, wish you the best and blessings.